I'm sitting in a comfy sofa because I actually managed to fuck my knee up. I'm not quite sure what I did. I went for a run after my night shift and then I felt really good. So I did a workout and then I was stretching. Something just went pop in my knee. I'm not quite sure what it is, but as soon as I told other people that don't work out, they were like, see, it's dangerous. You shouldn't run. You shouldn't work out. So anyway, so that's why. So if you're watching me, I'm actually sitting in my sofa today so I can shuffle around because my legs get really painful when I sit still for a long time. So that's why. Today, I want to talk about boundaries we want to uphold with our clients in the clinic. A lot of our pain and suffering come from not upholding boundaries or not having any boundaries with our clients. And then we are on this constant frustration game over clients not doing what we want or saying stuff to us we don't want or wanting stuff from us that we don't want to give them. Last week, I talked about boundaries towards our work colleagues and our managers and how to uphold them. So if you haven't listened to that yet, go back and listen to that after you listen to this one, because it's a completion of a series of 3 I want to do about boundaries for our colleagues and managers, boundaries for our clients today. And next week, I'm going to talk about boundaries at home. So you can kind of protect yourself in a way that cuts out a lot of the burnout that is in this career, right? I want to start out with a debate I was having on social media. Social media is amazing for debates, isn't it? We can all agree to disagree. Another vet put up a reel around using metronidazole in diarrhea and how studies have now proven that there's no clinical effect of it, and there's only in very, very counted certain cases we should use these strong antibiotics in diarrhea. And I totally agree with that. Like the latest conferences I have been to, it's just like antibiotics for very, very limited amount of things, because even cat abscesses and other things that I would use to give antibiotics to all the time, they are self-limited at cleaning them out, and just leave the cat be a cat that will cure itself. And the same is with diarrhea. A lot of people have the misconception that if you give them this bland diet, you give them probiotics, you give blah, blah, blah. If you don't end up giving them antibiotics, they're not going to get any better. Anyway, I don't know what your opinion is on this, but my opinion is do not give antibiotics unless you absolutely have to. And there is, science behind it, because I see a very bleak future in front of us where our kids and grandkids are going to literally die in birth bed because there are not going to be any antibiotics that are not going to be, they're not going to be valid for any antibiotics because they all are going to be resistant. So I'm a bit dramatic in that aspect, but I'm very strong on it. So I was participating in this debate and I noticed a few veterinarians were saying, but my clients are used to this. And one even went as long as to say, well, well, I'll forward the calls to you then when they keep calling me saying I need to prescribe antibiotics for this diarrhea because they know and nothing else will cure it. And it really made me stop and think about, well, why, if right, let's all agree that there shouldn't be an overuse of antibiotics, right? It's a really, really bad idea for so many reasons. And if a client comes in and asks you or demands of you, I want antibiotics. The last vet gave me antibiotics. I always have antibiotics for diarrhea. And you feel forced to prescribe antibiotics. Why is this? No, why when they ask of you, do you feel that you need to give it to them, or they have they're kind of entitled to it? No, because I thought, okay, so let's say a client comes in and says, I want a bottle of methadone and you have to give it to me because somebody gave it to me in the past. That would be a strong no, right? Well, I assume. Or ketamine, well, I always have ketamine, I just give it to my horse myself, or whatever argument they come up with. You wouldn't just give ketamine to a client, wouldn't you? You wouldn't just as happily give it to them. So why is it that some vets feel that if a client says to them, I had antibiotics the last time, or the antibiotics is the only thing that's going to work, why is it that they then feel that they have to give them antibiotics? And I think the answer is that because we're not quite sure ourselves, we doubt ourselves a bit. No, we're not quite sure because we have seen effects of it. And although the scientific studies show that it doesn't have an effect, well, is it really true? And there's this doubt behind it, no? And as I was thinking about this and I was thinking about how to approach this podcast, something happened to me this week. And I want to tell you the story about how I set a boundary for someone out of work, not related, but how I just felt so secure about this boundary I was setting. And I felt like there was no doubt in me. It was a very extreme situation. I could probably have gone into trouble for it, probably gone to jail for it. But my conviction was so strong that I set a boundary for a person with no doubt and there's just no hesitance from my part. And I was thinking, why is that one? Because I'm actually quite a people pleaser, and I will always doubt myself if someone says, yeah, but why would you do that? Or look, I did this and it worked, so why would you not give it? And it was the end of my night shifts, and I was on my way home. I had hurt my knees, and my knee was hurting, and I had to fly from Manchester and travel there from Kettering, which meant that I had to leave the night shift, get to the station. Luckily, my lovely night nurse, Sam, took me to the station. Shout out to Sam for saving my life. But then I still had to change trains 3 times, with the stairs, getting in and out, standing up, this and that, with a hurting knee after 13 hours night shift. And then 3 hours later, I get to Manchester. And of course, in Britain, there's this fun thing where you get a train ticket, but actually it's not for a train. It's actually for a bus, because now there is no train. So now you get a replacement bus. So I get off in I think it was Stockport, had to get to Manchester Airport. And now in Stockport, there was these like handmade signs. And sometimes they look like it's 5-year-olds in them out saying rail replacement bus this way. And you kind of follow these signs, and there's a bit of a treasure hunt to find this intimistic bus stop they've put up, which they had then put up in a very kind of narrow road where cars and buses and taxis had to drive around, kind of like, if you imagine like an oval roundabout that's quite tight. So all the way around this sort of roundabout, there was yellow double lines, which implied that nobody should park there. However, there were like some Ubers, there was a couple of taxis parked on the lines going towards the bus stop, which meant that when our bus came driving around the bend, it couldn't actually keep driving because the cars were in the way. So he beeped a couple of times, and taxis, they moved, the Uber moved. And then there was a big black shiny car. I can't remember the make of it. Somehow it didn't seem relevant. And I couldn't see if there was a driver inside, because, the windscreen was quite black and the sun was shining on it. And that car was not moving. And the bus was there trying to get to the bus stop. And we were like a bunch of people, obviously came off the train, everybody going to the airport. So there's a bit of like an urgency in this situation. And this car was not moving. And a gentleman with a trolley suitcase walked up, and I could see he was talking through the window to this person. Apparently there was a driver in the car. And I thought, that is so odd that he's not moving, because he's got a big bus behind him that obviously can't drive forward and get to the bus stop because only of this car, right? So I stood there and I was like, I don't understand what's going on. No? And then eventually the bus driver gets down, and I thought this could be trouble. The bus driver could get in trouble, because if this is some angry driver, they might, I don't know, confront the bus driver. And I thought, well, I'm a passenger on this bus. I felt I'm going to be hopefully a passenger on the bus. So I felt some sort of responsibility. I don't know why. So I wobbled over with my half broken knee and stood on the pavement, and the bus driver went over and spoke to the driver. And it turned out to be a female driver, and she was with her phone in her hand, and he's saying to her, I just need you to move a few meters ahead so I can turn the bus. And she said, well, I'm waiting here. I'm on my phone, and there's no parking for people, so I just need to be here. And he's like, but I need to move on with the bus. You're parked on double lines. And she's like, well, you can just reverse the bus, like this woman, right? And he's like, well, I can't do that. It's illegal. I've got passengers. He said, if we don't move, I will have to call the police. And she did not give a fuck. She's like, just call the police, do whatever, I'm here. And I had to set a boundary, because I was like, I am not missing my plane because of you, bitch. So I knocked on her window and I shocked her, because I think, so in my head, all these things are not really clear, but I think maybe because 2 men had spoken to her being a woman, she probably didn't feel threatened, knowing that if something goes to court between her and men, and she can kind of like say, I'm a poor woman that got like abused by these men. But me being a woman and me being really angry at this point, because also my knee was really hurting. I was extremely tired. I'd had a long journey, and I just wanted to get home to my Bruce, right, at my house in Denmark. So she looks at me, and I'm like, I'm not losing my plane because of you. You're gonna move. And she started talking, and I knocked on the window again to make her to lower it, and she didn't dare. And then I just took the handle and started pulling it, and I'm like, you're gonna move. And I think the conviction was that she was 100% wrong. And I had all these people behind me and the driver, and we were all right. There was just no, it was black and white. She was in her wrong. I do not care why she was there, but her refusing to move and being so disrespectful towards the bus driver who was being extremely patient made me really clearly go in and put my foot down. And I didn't quite know what I was going to do, but I was like, she's going to move. And I told her, you're going to move right now, or that you're really going to be in trouble. And I was scanning to look for stones to throw at the car. I was so angry. And then she drove off, and I'm like, okay, fine. And I didn't feel, normally when I am in a confrontation of any part, I get like really agitated. I shake. I'm like, oh my God, I feel really, but I was calm as nothing, because I was like, cool, we got rid of her. And then all the passengers was like, yay. And I thought, and then I was sitting in the bus, in the trail replacement bus towards the airport. And I was thinking, well, how did I do that? Because normally I just avoid conflict if I can. But I think it was this, like, there was this 100% wrongness with this woman. No, like the whole aspect of, I don't know what was wrong with her or why she was like what she was. And I did not give a shit, because she was just in the wrong. There was no doubt. And so that is the first bit of setting a boundary, is like you not doubting that you're right. And I think in the veterinary clinic, there's so many gray areas, isn't there? Because with the antibiotics, for example, we think, oh, but it's true. We gave it bland diet, we gave it probiotics, we gave it this, we gave it that for 3 days. It didn't get any better. We gave it antibiotics, and bam, it became better. No, that's not really a clinical study, isn't it? But that's in our brain, that's the doubt. And the client will say something to you that makes you doubt yourself. No, so that is one of the aspects, is, am I actually right setting this boundary? Is there anything, am I in the wrong here? And I think often in science specifically, we cannot know if something is 100% right, because how many times are, like, for example, eating eggs, like, so one day eat eggs, it's super good, you got a lot of protein. Next day, don't eat eggs, it's got too much cholesterol. Next day, eat eggs because it's got vitamin that. So science keeps evolving. And I think because we have studied science, and we know how fluctuant it is, and how one day one thing is right and next day it's not. And in 10 years, people will probably look back at what we're doing now, and they'll be like, oh my God, what were they doing with these procedures? Why didn't they give this? Or why did they give that? And because we doubt ourselves, which is healthy in science, when we have to set a boundary for a client, we also doubt ourselves, and they notice that. So when they notice that you falter and you're not quite sure, that's when they then will come up and be like, well, this is how I want it. The woman in the car saw me in my face, and she saw there was a zero doubt in my face that she was going to move. And like, I did not care what was going to happen. She had to move that car. That's what made her move. If I had been a bit like, oh, I don't know how we're going to do this, then she wouldn't have moved. It was this total conviction in my face. I do not care. I will go to jail for this if I have to, right? And in the clinic, it can be very difficult to stand up for yourself like that. So it can be boundaries in the antibiotic example, I think, is a good one. But let's see, other boundaries we could have is if they come in and they want to be seen by you, for example, and you're leaving now, but they want to see you and not another vet because you saw them last time, or they just want, because you're the senior and they don't want to see a younger vet. It can be difficult to say, well, this is actually my leaving time, and Dr. whoever is here to see you, and I will not see you because I have my kids and home and dinner to go home to. But then we doubt ourselves because we're like, oh, maybe I could do probably a better job. I did see it last time. And we doubt ourselves, and that's what makes us not uphold the boundary of, I was going to leave at 4, and now it's like I'm going to leave more towards 5 o'clock because I said to this person, okay, I'll see you. And then it turns into this long-winded consultation that was not just a straightforward thing, was it? Or another example can be when they call me at night. We have some specific clinics that we cover the out of hours for, and then there are other clinics that then have, for example, vets now, or they have like whatever, they have their own out of hour cover. And when somebody phones us, we have to say to them, look, you need to find your own out of hours provider, because that's just how it works. So we're not stealing clients from somebody else. And then there are the cases where it is like a cat that can't breathe, for example. And if they're closer to us, of course, they need to come to the closest place. And sometimes they want to come to us because maybe we are cheaper. And then it's like, where do you uphold that boundary where you do want to help them? You also don't want to steal clients from other vets that, you know, that have kind of set up their system. And it does seem like a very gray area. And that's where it can be hard to uphold the boundaries. So I have in my head, I have like some specifics, you know, depending on the case, depending where they are and depending why they ask, I will say yes or no. But because it's not so clear cut. So you need to decide, I think, upfront what is right and what is quote unquote wrong for you. So for me, for example, antibiotics, it's a non-negotiable for me because I have now seen so many so scary studies, and I try to brainwash you all that are still convicted that you should use antibiotics for everything. Like the resistance is not a joke, I'm telling you, right? And I think the latest 2 or 3 people I know or have heard of that died in hospital actually did not die of what they went in for. They caught an infection in hospital and they did not have antibiotics for it. And these people in their 50s or whatever died because there wasn't antibiotics for them. So for me, resolving a diarrhea 2 days earlier using metronidazole is not worth the price of somebody I know or my kids dying in hospital because there's no antibiotics for them. So for me, that's a very clear black and white. So ask yourself, where you're not setting boundaries for your clients, how can you make it more black and white in a way that serves you so you are more convicted and they can see it in your face, like, this is how we do things here kind of attitude when you set the boundaries. And I'm not saying you should be a cold-hearted bitch and just like, I will never do this thing. Of course, it is science, it's biology, it's medicine, it's human, there's so many things involved. So we don't have to make everything black and white, but I think whatever can serve you and sometimes the client as well, right? Because antibiotics and diarrhea is not serving the puppy or whatever it is either, because you're killing off the microbiome, right? So there's science behind not giving the antibiotics. A boundary behind you not staying longer at work for one specific client means that that client will keep seeing you for many, many years and can have you when they actually make an appointment in well in advance, because you're going to be there. You're going to influence the clinic with your way of thinking, because you're going to stay, because you have boundaries and you have time off and you have a life next to the clinic. If you get burnt out because you never uphold your boundaries, you might seem that, so it's a bit like peeing your pants to stay warm, right? In that moment, you feel great because you stayed and that client loves you because you stayed for them and you made them feel really special, and you feel special because they wanted you. But long term, if you don't respect your leaving time, you're going to burn out and you're going to hate that place, and you're going to end up leaving that clinic and maybe leave clinical work totally and end up selling medicine or something, which is not bad, but you're not serving that client then long term, aren't you? Because you are leaving the clinic. Another boundary also can be when they, you know, when, for example, they keep talking, no, they're in consult and they keep talking, and you're like, I need to get a move on this because we are busy, you know. And there I've gotten really good at that now. So for example, we had a crazy busy night this week where I ended up having a client and their pets in each consult room. I think we have 4 rooms, so one couldn't breathe, one had a penis dog, another one had a dog attack, another one was a non-eating rabbit, and I was kind of like treating them on the go, and I did not have time for long stories and what happened to their grandma or nothing, because I just had to try and save and relieve suffering for all these animals and just do the best I could, no? And in that case, I have to cut it short. I say, I'm really, really busy. I just need the basics now. And I ask, not in a rude way, but very direct, like exactly what happened, what time did it start, how long, you know, and I move on to the next one. And other times we have a lot of time. No, for example, the night of the England versus Spain, the football, we have 2 hours with nothing, right? So we did an operation and I had some people phoning on the phone, and I took my time chatting to them because I also love chatting to people and learn about what they do in life and how long have they had these animals, what's their history. I'm very interested in people, but I do it when I have the time. But I'm also very good at when I don't have the time and it's literally a shit show, then, you know, I have to cut off and I make it very clear and I let them see, you know, we come in with blood all over us and I'm like, we're really busy. I want to help you. How can I do it the fastest way possible? And having this specific way of setting boundaries and consult and cutting down the time so you then can serve the next client appropriately because you're not running behind and you're not stressed is also a really good boundary to be able to set. And I think when we talk and talk and talk and we let the client talk and talk and talk, it's also because we have a bit of a doubt whether not as much as we are right, but more which is my second point, our right to set a boundary, which is comes back to our self-worth. Let me see, I wrote it down. It seemed really clever 2 seconds ago. Yeah, so it's basically we are worthy, and we have enough like right in ourselves to set a boundary. I don't need to over-explain and over-explain and over-explain something that I want to do or not do to your pet. We just have to have a clear communication. And I don't need you to tell me everything about what your puppy has eaten for the last 18 months. I just need what it has eaten for the last month. And you can say that, you can come across and set that boundary and stop the flow of words from them if you believe that you are worthy of setting that boundary. Does that make sense? When you are really doubtful of yourself and you don't, for example, you don't think maybe you're good enough at taking a history, or you're not good enough at conveying what you want to say, that's when we come into this like mishmash of words just going in and out and not being very helpful. So you need to feel with yourself that I am worthy of just cutting this short because I know what I'm doing. I'm good at my job. I know how to communicate, and I know how to get out of you what I need to treat your pet in the best possible way. I think that's what I wanted to say in this. And also well, coming back to who's right and who isn't, is also our job to educate the clients, right? So if a client comes in and wants something off you that you think this is not right, don't ask me to stay past my leaving time, don't ask me to prescribe something for you that I don't want to prescribe, don't, all these things. It's also our job to educate them, right? Don't expect clients to know these things. Like they don't know what goes on behind the scenes. They don't understand all the science behind it. So you need to educate them enough that you can explain this is the boundary and this is why. And then my third point is also accept that they might not like it. So some clients will not like you telling them that they're not getting antibiotics for the diarrhea. Some clients will not like you telling them that you're not staying behind because of them. And some clients will maybe not like you cutting the conversation a bit short, but honestly, like if you do it with love, like you can do it. No, but if you're not very experienced in it, then you need to practice cutting the conversation short so you can move on to the next one and just get the essential information necessary. But you have to accept that some people will not like your boundaries. That's why you need to set the boundaries, because if they always were 100% accepting of everything you ask of them or everything you say, then you wouldn't need to set the boundaries. And if you thought in the same way, if you were completely aligned with everything, and if you all had the same information, if you all had the same perspective, you wouldn't need to set a boundary, right? But the problem, quote unquote, is that people don't have the same point of view. We don't have the same perspective. We don't have the same education, and hence you cannot have the expectation of people knowing what's right or wrong, quote unquote, also knowing what your boundaries are, because they just don't understand it. So you need to educate people on it enough that you feel that you have transmitted the information. You need to trust yourself enough that I have told them, now they can process or whatever. I don't need to over-explain myself because I'm good at my job. I know what I do. This is how we do things here, right? So have that inner trust, and also be convicted that this is the right thing to do. Like that combination of knowing that, trusting yourself, trusting that whatever process you have decided to have is the right one, and not let people challenge you on it. And again, it comes back to, again, science is not very black and white. There will be gray areas, but decide upfront how you want to handle that. So for example, people calling me in the middle of the night saying, we want to come to you, although you're not my out of hours provider. In which cases do I want to say yes? In which case I'm like, no, listen, you need to go to your own, because I have to take care of all the patients I have promised to take care of, which of these, whatever number of clinics we are covering, right? So that is how I set boundaries for people. And that is also the mental explanation, the emotional reasons, like why it can be so hard for us, is this lack of trust we have in ourselves, this lack of conviction that we're doing the right thing. And again, being scientists, but being in healthcare, it's good to have a healthy amount of kind of doubt, in the sense that we always come back to checking, are these antibiotics correct for these things? Is this the right procedure? Is this the right way of doing things? Because we know things change all the time, but also not let clients blackmail you into doing something, because again, it's like peeing your pants to stay warm, but then you become really cold long term, right? I hope this was helpful. If you really like this episode and if it really resonated with you and you know someone who could benefit from it, please share the episode with them so they can listen to it as well and hopefully get better at setting boundaries. Setting boundaries is so essential for us not to burn out. It's the number one cause of burnout is not setting the boundaries and just let everybody just juggle you around and you're never in control. So please use what I said in this episode and reach out to me on socials, or if you're on my email list, send me an email, let me know how you liked it and what resonated and what didn't. Maybe like challenge me on it as well. I love to debate things, as I said, on social media. So let me know, and again, share with someone who might benefit from it, and see you next week. Bye.